Welcome to America, where you have to go to jail to get the health care you need. Stephen Espelin, 57 years old, told a judge last week that he really didn't want to kill President Obama or his family like he told the Secret Service earlier. That he really did this. He threatened the president in order to get arrested. And in fact, he's just been sentenced to 4 years in prison for threatening the life of the president. He said that he did this. I mean, he's come out now after he was sentenced. He was willing to talk about it, but he wanted to make sure he got his 4-year sentence. He did it because he didn't have health care. He went to a hospital. He checked in under a phony name saying that he had insurance. He had cancer and heart disease. When they discovered that he had used a phony name and didn't have insurance, they literally kicked him out of the hospital. So now that he's in jail, he's getting the chemotherapy he needs. Apparently, it's a fairly mild cancer. It'll be knocked out. And then he is scheduled, once he starts his prison term in a few months, to get heart surgery. Same thing with James Richard Verone in North Carolina. Back in 2011, he walked into a bank, told the teller he was robbing them of $1, took the dollar, walked over and sat down on a bench, waiting for the cops to come and get him. He'd been a delivery driver for Coca-Cola for 17 years. He got laid off, and he had a protrusion on his chest as well as arthritis and carpal tunnel syndrome, so he couldn't work, which meant he couldn't get a job, which meant he couldn't get health insurance. And so for him, again, the only way to get health insurance was to go to jail. Or Ron Paul. You know, this is the great champion of libertarian. Kent Snyder was his campaign manager in 2008. Kent Snyder raised millions of dollars for him. However, Ron Paul does not pay health insurance for his campaign staffers. He figures, hey, let them stand on their own two damn feet, right? And so Kent Snyder ran up. He had a pretty bad infection in his chest, and he kept ignoring it and ignoring it and ignoring it, and finally went to the hospital, and it was too late. He died of pneumonia and left a $400,000 bill to his family, which the Ron Paul campaign said, ain't ours. So what are we going to do in the United States? Peter Suderman is with us. He's a senior editor and columnist at the Reason magazine, reason.com. And Peter, first of all, welcome to the program.
Thanks for having me back.
Thanks for for coming back on. What possible reason would libertarians have for saying that we should not have a national health care program, given the kind of stories that I just shared?
Well, I think there's two things that I would say here. One is, if you're going to talk about a national health care program, you have to define what you actually mean by that. We have a number of national health care programs right now. We have Obamacare, which is about to kick in. We have Medicare. We have Medicaid. And so that brings
we have the VA.
Thing. We also have the VA.
VA is socialized medicine. Medicare and Medicaid are single-payer medicine. Obamacare is a hybrid system that's part private, part public.
Well, Medicaid actually relies an awful lot on private contractors and private insurers, and Medicare has some sections that are run through private insurers as well.
No, but they're both fully paid for by the government.
They are.
So they're single-payer programs.
Yes, by the federal government. In Medicare's case, state.
You said I had to define this. Let me lay down a simple definition for you. There are some things that are just too big for all of us to deal with, and healthcare is one of them. I mean, this is crazy that we're spending twice as much as any other country in the world, and we have a shorter lifespan than the average lower middle-class Frenchman.
So here's the question I would ask is the problem that we don't have programs, or is the problem that we have programs that aren't working very well and that are poorly designed?
The problem is that people like you advancing this libertarian theology, and it's just clearly a theology. I mean, it's a belief system without facts. People like you have been promoting this theology all these years, and they prevented Richard Nixon from doing it. They prevented Barack Obama from having any kind of, we're the only nation in the developed world that doesn't consider health care a right instead of a privilege. You have a right to a lawyer. If you get arrested, the government will provide you a lawyer for free. Why don't you have a right to health care?
So, in the case of the first individual that you mentioned, he's from Florida. Florida spends $18 billion a year on Medicaid. That's out of, like I said, $400
He does not have a right to health care in Florida.
Enough? Are we not spending enough money?
He does not have a right to health care in Florida or in any other state in the union.
People in Medicaid in Florida, that is a huge program.
He does not have a right to health care in Florida.
programs for the people who are
Peter,
medically needy.
why do you think that health care should not be a right? What part of the right to life, liberty, and the pursuit of happiness is incomprehensible to you?
Well, clearly we already have tens of millions of people who have health care benefits given to them through the government. Medicaid covers 60 million people in the United States.
Then if we've gone that
already.
far and you agree with that, why don't you just say, okay, we have a right to health care, now let's do it in the most efficient way possible?
I would like to see a much more efficient system. Now, we would probably disagree on what the efficiencies that could be.
But wait a minute. Will you acknowledge that we have a right to health care?
Terribly inefficient system as it stands that is not.
Are you going to acknowledge that we have a right to health care or not?
We do not have one built into our legal system currently.
Okay, so you are of the opinion that
$1 trillion or so worth of health care programs that aren't working very well.
So you're of the opinion that life, liberty, and the pursuit of happiness, our founding document, I realize it's not part of our laws, but it's our founding document, that the right to life that is defined in the Declaration of Independence does not include the right to keep your life. If you get sick and you can't afford to pay for health care, sorry, you're dead. You got no right to life.
So, again, these are, complicated semantics.
There's nothing complicated about that. You either have a right to life or you don't have a right to life.
Life is a right. I mean, again, this is basic philosophy rather than actually discussing the program.
No, it's saying every person in America has the right to access a healthcare system that will keep them alive or not.
How can we spend it better? But if you want to talk about this, then the question you ask is a right to life a right to require someone else to do something for you?
Do we have a right to life?
Do we have a right to require someone else to do something for us?
Peter, to the best of my knowledge, no doctor in any hospital, no nurse in any hospital, one of my daughters is one of them, is required to show up for work. Do you know of any who are? I mean, even in our jails, we don't take doctors who have been convicted of murder and say, okay, now you're the doctor in the jail because you're required to be in the jail.
That's certainly it's certainly the case that they are no more required to show up for work than anyone who is employed.
Okay. We've hit the clock. Peter Sunderman, you can read all about it at reason.com. Thank you, Peter.
Thanks for having me.